Serving all of San Diego, this is your Fox 5 News.
Well, a new study suggests women who gain too much weight during pregnancy can cause increased health problems to themselves and to their baby. So Dr. Samuel Wood is here to break down the study's findings and explain how women can maintain a healthy weight during pregnancy. Dr. Wood, good morning and thanks for being with us.
Good morning.
I was reading up on this over the past few weeks, and I was actually amazed at how much women should be eating and should not be eating when they're pregnant. We're going to talk about some of the tips and what they can do, but tell me about this new study that just came out.
Well, first, I think it's important to realize that 60% of women who become pregnant are overweight to begin with.
60%?
60% in the United States. And a lot of these women realize they're going to gain weight during pregnancy and they say, hey, let's just go for it. I'm eating for 2 now. But actually, it only takes an additional 300 calories a day to take care of the baby. So in this particular study, they looked at over 500,000 babies born.
Okay.
Over 500,000 women with over 1 million babies born. And they compared pregnancies in which a woman gained an appropriate amount of weight versus those where they gained an excessive amount of weight. And what they found is when the same woman gained excessive weight, they had twice the chance of having a high birth weight baby.
Wow. What is the normal amount of weight that an average woman should gain during a pregnancy with just one child?
Well, it depends on where you start. If you start at a normal weight, you should gain 25 to 35 pounds. If you start out overweight, 15 to 25. And now, scientists are saying that if you start out obese, maybe you don't need to gain any weight at all.
How is that possible, to not gain any weight at all during? You were just telling me about a study of a woman that had triplets and she only gained 2 pounds?
Well, the babies are very effective at getting what they need.
Okay.
And so if you start out obese, the babies will draw what they need from your excess weight.
So it says here women that gain more than 52 pounds are almost 2.5 times more likely to have high birth weight babies as women who gain less than 25 pounds. So basically, if you're gaining weight during the pregnancy, your baby is going to be a little bit heavier. Is that basically what the study said?
Yeah, the metabolic changes that you have when you gain that much weight, they actually affect the baby's organs and brain so that that baby has a much greater chance of being obese later in life and having problems associated with obesity like high blood pressure and diabetes. The decisions you make during a pregnancy profoundly affect the lifetime of that baby.
Well, speaking of those decisions, I'm sure there might be some people that are watching right now, some women that are pregnant currently, could be thinking about getting pregnant. What are some tips and things that they can do now before they even are pregnant, or if they are in their pregnancy, to help maintain their weight and not to let something like this happen?
Well, I think any woman who's overweight or obese should see a dietitian. This has to be done exactly right. It's not just 300 calories. It needs to be 300 calories of the right kinds of things. And I brought some things here that make the point. Here with these cookies, 2 extra cookies a day, that's your 300 calories right there.
2 extra cookies is a 3.
That's it.
Okay, this is what I was just talking about this with somebody that I said when I realized you're supposed to eat 300 calories a day. That's not a lot of calories, doctor. I mean, put that in perspective. I'm thinking 2 cookies. I'm thinking like an extra, like what, 2 apples is almost 300 calories a day, where a lot of people have that mentality that I'm eating for 2. That means 2 Big Macs. Right. That means 2, sandwiches.
That means I need to double every meal. If I'm getting 1 Big Mac, I need another.
And that's
a Big
not
Mac
true.
is what, 500-600 calories?
Right.
You're way over with 1 extra Big Mac. So you have to be very careful about what you take and realize you're not really eating for 2.
What can they eat?
But there are some healthy things here. And for example, these carrots, you could have 4 bags of carrots and that would equal 1 cookie. And you could have this, sort of healthy apple chips here, and that would only equal 1 cookie, and God knows how much of that broccoli you could eat before you get to the 2 cookies. So there's some healthy things that you can eat that can help you get to the 300 calories without having a negative effect on the baby.
Okay, so lean meats and proteins we know are rich in iron, so it's good to eat that, and also leafy green veggies. Most of the weight too, from what I'm reading here, should be gained in the 2nd or 3rd trimester. So most women probably won't even gain it in the 1st, or should not gain it in the 1st.
In the 1st trimester, 0 to 5 pounds is fine. After that, if you start at a normal weight, you gain about 1 pound a week. If you start overweight, you gain about 0.5 pound a week. Is kind of an ideal target to shoot for.
Well, good information, Dr. Wood. Thanks for stopping by and sharing this information with us. Good to see you.
Good to see you.
All right, Raul, did you hear that?
Yes,
2
indeed.
cookies,
Yep.
300 calories.
That's it. That's all it takes. Good information, Shali. Dr. Wood, thank you.